Hello and Assalamualaikum. I am Sumaida Omar. Together with Mr. Nasrul Abdullah and Mr. Hadeo Langkaya, we will be discussing about the schizophrenia and other psychotic disorder by Nicholas Tarrer and Romina Taylor. So let us begin with what is schizophrenia. So schizophrenia is a serious mental illness that affects how a person thinks, feels, and behaves. It has a positive and negative symptoms. So, it usually begins in late teens to adulthood, but it can also appear later. So, people with schizophrenia may have trouble knowing what is real and what is not, and they may act in ways that seem unusual or confusing to others. So let's move on to the positive symptoms. So positive symptoms means it reflects an excess or distortion of normal functioning. So it is a sign of mental condition tulad ng sa schizophrenia that show extra or unusual experiences that most people don't normally have. So they are called positive not because they are good but because something extra is added to the person's experience or behavior. So for example, yung hallucinations, this means seeing, hearing, or feeling things that aren't really there. So for example, a person may hear voices talking to them even when no one is around. Or they might see someone who isn't really there. Second is delusions. These are strong beliefs that are not true even when others show proof. So, for example, a person might believe that someone is spying on them even though wala naman talaga. So, another example is disordered thoughts or thought disorder. This means naman the person's thinking is mixed up or hard to follow, magulo siya, and their speech might not make sense or they might jump from one topic to another without a clear link. So in short, ang positive symptoms are extra behaviors or experiences that are unusual and not part of normal thinking or perception. So these symptoms can make it hard for a person to connect with reality. So next naman is the negative symptoms. So it means frequently present and reflect a decrease in or loss of normal function. So ito naman, this is a sign of mental health condition that show a loss or reduction of normal abilities or behaviors. They are called negative because something that used to be there is now missing or reduced. Like for example, restriction in the range and intensity of emotions. In short, a lack of emotion. So this means the person doesn't show feelings the way people most do. So their face may look blank, and they may not smile, laugh, or look sad even when it is expected. So for example, kapag nag-joke ka, imbes na tumawa yung tao, blanko lang, nakasmile lang siya, ganun. Or di kaya kapag nakarinig siya ng sad news, pero hindi siya nalulungkot, hindi mo makikita na malungkot siya. So, second example is fluency and productivity of thought and language. This means the person has a hard time thinking clearly or expressing themselves. They may give short, simple answers and not speak much. So, parang another term is may mga minimal speech lang sila. So, yun nga, kapag tinanong mo sila, okay lang palagi, ganun. Maiksi lang yung mga sagot nila. Third example is the initiation of behavior. No? This means the person loses the drive or motivation to do things. They might stop doing everything activities like bathing, going out, or even eating regularly. So, example, a person may still stay in a bed all day, not because they are lazy, but because they just don't feel the push to do anything, even yung mga basic task lang. So, in short, lack of motivation sila. So, itong negative symptoms are not about doing bad things, but more about not doing normal things, like showing emotions, talking easily, or taking care of themselves. So, these symptoms can make daily life and relationship hard. So next slide is about treatment options. We have the antipsychotic medication, case management, and cognitive behavioral therapy for psychosis or the CBTP. Etong antipsychotic medication naman no, for schizophrenia is medicines siya that help reduce or control symptoms like hallucination, delusions, or confused thinking. So, they help the brain work more normally, usually taken daily siya, either as a pill or injection. So, second is yung case management naman. This is when a case manager, often a social worker or nurse, helps the person with daily needs, like going to doctor appointments, taking medication properly, connecting with support groups or services naman. Pangatlo, the most important thing is the CBT for psychosis. At itong CBT means cognitive behavioral therapy. So, this is the type of therapy especially made for those people with psychosis, in which they were able to analyze their thoughts, or may matutulungan silang i-analyze yung thoughts nila. So, through the help of CBTP, it teaches them how to cope with voices or beliefs that bother them. Rather than it doesn't force them to change what they believe, but helps reduce stress or confusion. So, according to the experts, based on research, ang CBT daw ang dapat na i-offer sa mga taong may schizophrenia with medication. So, let us now move on sa development of CBT for schizophrenia. So, it was said that CBT was first used for anxiety and depression noong 1980s to 1990s. So, basically, yun nga, ang CBT was originally used more for anxiety and depression noong 1980s and 1990s. Pero psychologists started using it sa schizophrenia din. So, it was later applied to help people with schizophrenia, and most progress happened in the United Kingdom or sa UK. So, yun nga, kasi doon sa UK, madaming psychologists working in adult mental health. And ang maganda pa doon, sa UK, they have a system called National Health Service. So, libre yung healthcare nila doon, and this help spread CBT across different conditions, even sa psychosis. So, it was said that psychologists were trained sa iba't ibang mental disorders, and madali for them na i-apply yung CBT sa may mga schizophrenia. So, sabi nga dito, they were able to transfer skills. So, yung knowledge nila sa anxiety or depression, ginamit na nila sa schizophrenia. So, ang CBTP doon, yung mga psychologists doon, many were trained well din sa UK na, and yung mga education nila doon supported by the government. So, yun nga, isa yun sa mga naging reason bakit naging successful ang CBT, dahil well-funded ang training ng psychologists sa UK. So, more people knew how to use CBT properly. But then, there were still problems in making CBTP available everywhere, kasi nga may mga challenges pa rin sa pag-spread ng CBTP sa lahat ng services, like hindi lahat ng lugar sa UK available ang CBTP. So, kulang pa sa access or support minsan. Next naman is let's talk about the symptom management in chronic schizophrenia. So, it is said here that in spite of maintenance medication, a considerable percentage of patients continue to have persistent hallucinations and delusions. So, yun na, kahit na may mga maintenance medication na yung mga pasyente, no, marami pa rin talaga sa kanila nakakaranas ng persistent symptoms, tulad ng hallucinations, delusion, na hindi nila basta nawawala sa gamot lang. So, dito pumapasok si CBTP, no? Or yung cognitive behavioral therapy for psychosis. Ginagamit ito as an extra support para tulungan silang i-manage ang thoughts and behaviors nila, especially pag hindi na masyadong tumalab ang gamot nila. So, the majority of the CBTP studies have been carried out with patients who have chronic illness. So, according to studies, moderate ang effect ng CBTP. Ibig sabihin, hindi man ito magic cure or ma-cure lahat, pero may positive improvement sa symptoms. So, another strategy has been to adopt a less generic approach and instead choose CBTP to target a more defined participants group or a specific symptoms. So, yun ang pinakamas interesting pa. Mas naging effective ang CBTP kapag ginagamit siya sa specific groups or problems lang. So, for example, instead na ibigay sa lahat ng mga ng may schizophrenia in the same way, mas maganda kapag targeted daw siya. So, gaya ng mga taong may early psychosis or may issues sa social life. And actually, marami pang specific examples kung paano ginamit ang CBTP to manage schizophrenia. So, like for example, dito sa study ni Fowler and colleagues 2019, no? Tinarget nila ang mga kabataan na may early psychosis at hindi nakakapasok sa trabaho or school. So, binigyan sila ng CBTP na focus sa social recovery. And yung results ay naging okay siya. It was great. Mas naging active sila sa weekly routine nila and nabawasan ang hopelessness nila. So, hindi lang symptoms ang na-manage, pati quality of life nila gumanda rin. So, may isa pa ding study, no, itong kay Grant at al. 2012. Para naman, itong study naman nila is para naman sa mga schizophrenia na may cognitive problems. So, pinagtuunan nila ng pansin yung motivation and daily functioning ng tao. So, after ng therapy, sabi sa findings, gumanda ang global functioning nila. So, ibig sabihin, mas naging maayos ang galaw nila sa araw-araw. So, mayroon ding study tungkol sa pasyente na sumusunod sa utos ng voices nila. Tinatawag itong command hallucination. After ng CBT, nabawasan yung paniniwala ng pasyente na powerful or all-knowing ang voices nila. So, mas bubaba rin ang depression and distress nila. So, nagtagal ang epekto up to 12 months daw. So, next is, meron ding more successful approaches developed to treat delusional beliefs by addressing worry, insomnia, and reasoning. So, finally, may bagong CBT strategies na tinatarget din ang specific causes ng delusions, gaya ng worry, insomnia, ng maling paraan ng pag-iisip or reason ng biases. So, instead na puro symptoms lang ang tinutukan nila, pati yung mga yung nagtitrigger sa delusions is ina-address na rin nila ngayon. So, next slide is, let's talk about the symptom recovery in acute schizophrenia. So, dito naman, ibig sabihin nito, ito yung time or panahon na yung isang tao na may schizophrenia is nakaka-experience ng matinding psychotic symptoms like yung hallucinations, ng delusions, or ng agitations. So, ngayon, may mga ilang studies na nag-try gumamit ng CBTP during this acute phase. Pero dahil unstable or suspicious minsan yung mga pasyente, hindi fix ang style ng therapy. So, ang ginamit nila ay tinatawag na therapy envelope, kung saan flexible ang haba ng sessions and depende sa status ng pasyente. So, first study dito is yung atong kila Jory Birchwood at 1996 and Haddock Tarver at 1999. So, based sa study nila, may malaking pagkakaiba sa result. So, yung isa daw may effect size na 0.9 and yung isa naman 0.93. Ibig sabihin, may inconsistency pero may potential. So, sa second study naman nila, merong malaking study na tinatawag na yung sa CRIDS or Study of Cognitive Reality Alignment Therapy as in early schizophrenia na ginawa siya ni Lewis et al. 2002. So, dito naman, 309 early onset schizophrenia patients ang sumali. So, ang effect size dito is 0.12 lang. Maliit. Pero may counting improvement naman daw. So, sa sunod naman na study after 18 months, sinundan pa ito ni Tarver, Lewis et al. 2014. Napakita ito ng benefit ng CBTP at supportive counseling. So, kinumpara nila sa treatment as usual or yung tao, medyo significant ang pagbabago sa auditory hallucination. So, mas bumuti sa CBTP group. Then, isang mas bagong RCT ang ginawa ni Jackson at noong 2008. Na-focus naman ito sila sa mga first episode psychosis patients. So, binigyan nila yung mga patient ng befriending therapy. So, ang result, mas gumanda daw yung functioning ng CBTP group by mid and treatment na may effect size na 0.39. Pero hindi nito nabago yung symptoms mismo daw. So, after 1 year, wala nang difference sa outcomes between CBTP and befriending. So, isa pa, walang treatment as usual group dito. So, hindi natin masasabi kung gano'n talaga ka-effective ang CBTP compared sa usual na treatment. So, in short, may mga signs na nakakatulong ang CBTP during acute phases, especially sa early recovery. Pero kailangan pa rin ng mas maraming research para mas ma-confirm ang consistency ng effect niya. So now let's talk about the relapse prevention sa cognitive behavioral therapy for psychosis, no? So of course, when we say a relapse, it is an important outcome because of the disruptions, the stress, economic cost that a symptom exacerbation brings. So, of course, malagang ma-prevent natin itong relapse kasi kapag bumalik or lumala yung symptoms, nakakagulo ito siya ng life ng pasyente, emotionally, physically, at pati na rin sa pamilya nila. So, why is the prevention important in CBTP? Well, of course, itong relapse sa psychosis, big deal talaga siya, like super disruptive siya sa life ng patient, pati sa family. May emotional stress, gastos, minsan balik hospital pa. So, kaya CBTP or cognitive behavioral therapy for psychosis is used to help delay or prevent relapse. Pero ang question is, effective ba talaga siya? So, yun nga, based sa study nila Barrier and Wakes noon, kapag yung CBTP daw hindi nakafocus sa relapse prevention, konti lang effect niya, like 1.4% lang ang nabawas sa relapse. So kapag nakafocus talaga siya sa relapse, mas malaking improvement, nasa 21% reduction doon. Then may meta-analysis din si Serin et al. And nakita nila wala daw siyang proof na mas effective ang CBTP compared sa ibang therapies or regular treatment in preventing relapse. So parang di pa solid yung evidence talaga. So now, when is CBTP most effective ba? So according to the study findings, based on a study of Jackson et al. 2008, CBTP in the acute phase is equal to no effect on hospital admissions or days. So, yun nga, during the acute phase ng psychosis, sad to say, walang effect sa hospital admissions or total days in the hospital. Then, according naman sa study nila, Garrity et al. 2008, no, plus family therapy, nag-relapse yung, nag-try sila ng CBTP plus family therapy after nag-relapse yung patient. So, walang malaking effect sa relapse itself, pero nag-improve yung depression symptoms and social functioning ng patients. So, next naman is, ito yung interesting part. Si Don et al. 2012, according sa study niya, nag-review ulit ng data gamit ang bagong method. So, ang finding nila, effective pala daw yung CBTP, but only if natatapos talaga yung buong therapy and may specific strategies targeting relapse. So, dapat complete and tailored yung sessions. So, overall, ang learning natin dito sa CBTP, no, it has a potential, especially kung nakafocus talaga siya sa relapse prevention. Pero, hindi siya magic. Like, kailangan full participation ng patient and dapat well-planned yung sessions. So, some studies show success, others don't. Kaya, more research pa talaga ang needed para mas clear kung gaano ka-effective ang CBTP long-term. And now naman, proceed tayo sa early intervention in psychosis. So, CBTP proved more beneficial than tau in preventing progression into psychosis, preventing the prescription of antipsychotic medication, and reducing symptoms. That's according to the study of Morazan et al. 2004. So, ang early intervention or mas magang pag-respond sa mga taong nasa risk pa lang ng pagkakaroon ng psychosis is mahalagang hakbang na sa mental health care. So, yun nga, ayon sa study nila Morrison et al. 2004, gumamit sila ng CBTP sa mga taong nasa prodromal stage pa lang. Ibig sabihin, wala pa silang full-blown psychotic episode, parang may early warning signs na. So, ang naging resulta, mas beneficial ang CBTP kaysa sa treatment as usual daw or yung tau sa pagpigil ng paglala ng condition ng pasyente. So, na-delay and naiwasan ang need para sa antipsychotic meds at nabawasan yung symptoms. So, sa next study naman ni Morrison, French, and et al. 2012, there were no difference between the groups in terms of transition to psychosis over 12 to 24 months daw. So, yun nga, nung sinubukan ulit nila sa mas malaking study na, itong sila Morrison, na multi-site pa, so ibig sabihin maraming lugar ang sinali, hindi na ulit ang parehong resulta. Wala raw malaking pagkakaiba sa bilang ng mga nag-transition into psychosis kahit CBTP ang ginamit. So, ang sabi ng mga authors, baka kulang lang sa power ang study dahil mababa ang naging conversion rate sa control group. Ibig sabihin, hindi rin naging gaanong nagkasakit ang mga hindi nabigyan ng CBTP, kaya hirap makita ang effect nito. Pero may good news pa rin naman daw kasi kahit hindi napigilan yung full psychosis, nabawasan din naman yung delas and attendee ng mga sintomas. Kaya mas clinical benefit pa rin ang therapy, yung cognitive behavioral therapy. So, based naman dito sa study nila Bird et al. 2010, early intervention services allowed better access to and engagement with treatment as well as reduce relapse rates, hospital admissions, and symptoms. So, yun nga, kapag ang treatment is bahagi ng early intervention services na may kasamang CBTP, family therapy, and gamot, mas maganda yung access at engagement sa treatment and mas konti yung relapse and hospital admission and at the same time, mas gumaan yung symptoms. So, kahit palaging 100% effective ang CBTP sa pagpigil sa psychosis, kapag sinama ito sa isang holistic treatment, no, plan sa early stage pa lang ng sakit, mas malaki ang chance na gumanda ang lagay ng pasyente. So, ito yung dahilan bakit mahalaga talaga na ang early intervention services, hindi lang para magamot din siya agad, kundi para maiwasan yung mga malalang effect ng schizophrenia dun sa life ng tao. And now, let's move on to the basic clinical principles, no? Of course, when you use CBTP, it's important to establish a therapeutic relationship. So, in short, engagement and establishment of therapeutic relationship. So, bago magsimula ang therapy, kailangan mabuild muna yung trust sa pagitan ng therapist and ng pasyente mismo. Kasi nga, ito yung foundation ng buong process. No? Kapag comfortable lang ang pasyente, mas open silang magkwento and makinig sa payo nyo. So, kung may pasyente ka na paranoid, hindi mo siya basta-basta mapapa-open up kung hindi siya komportable sa'yo. So, second is individualized case formulation. Assessment based on individualized case formulation naman. So, ito, hindi siya one size fits all ang approach. Kailangan intindihin ang personal story ng pasyente, kung paano nagsimula yung delusions or yung hallucination niya, and paano siya nagre-react emotionally and behaviorally. So, weight matters. Bakit siya nagmamatter? Kasi kapag alam mo ang pattern na experience niya, mas mabubuo yung target strategies. So, next is itong focus on symptoms management, not just elimination. No? So, of course, patients are taught to be aware of their symptoms and learn methods to manage them. So, hindi lagi nawawala yung symptoms, no, tulad ng hallucination, para matututo ang pasyente kung paano ito kontrolin and hindi matakot. Kung dati tatakot siya sa boses, ngayon, natututo na siya na i-ignore ito and at the same time pag-isipan na baka hindi ito totoo. So, next naman is overlearning of coping strategies. This is to ensure that these coping strategies can be implemented outside of the therapy. So, tinuturuan ng pasyente ng step-by-step skills para harapin ng delusions or hallucinations. Tapos, inuulit-ulit ito hanggang sa maging automatic siya. Para kahit wala ng therapist, kaya nilang gawin mag-isa. So, pwede nilang gawin breathing exercise, guided imaginary, relaxation, attention switching, or etc. So, next naman is challenging unhelpful beliefs. The voices are all powerful. And, yun nga, yung I must obey the voices. Tinuturuan ng pasyente na i-question ang power ng delusions nila or ng voices. No? Ginagamitan ito, of course, ng cognitive techniques tulad daw ng Socratic questioning, which means, paano tatanungin mo sila, like, paano mo nasabi na totoo yan? Ganun. So, mayroon din yung tinatawag na Colombo technique or acting puzzled siya to make the patient think critically. Next naman is the use of behavioral experiment and reality testing. This is to weaken delusional explanations, no? So, gumagawa kayo ng behavioral experiments para ipakita sa pasyente na maaaring hindi totoo ang paniniwala niya or pinapaniwalaan niya. So, kung akala niya pinapaya siya sa church, no? Bumalik siya doon and nakita niyang tinanggap pa rin siya. So, yun nga. in real life experience, no, tumutulig sa talaga sa delusion is mas effective kaysa sa pagsasabi ng hindi yan totoo. So, next naman is addressing safety behavior. So, particularly attention is paid to identifying avoidance and safety behavior. So, minsan yung mga coping behavior ng pasyente, halimbawa pag-iwas sa tao, nagpapalakas pa rin ng delusion. So, tinutulungan sila na unti-unting baguhin or alisin ang mga behavior nila. So, next is negotiating realistic goals for fixed delusions. So, in some refractory cases, the clinician must negotiate treatment goals aim at reducing distress. So, kung sobrang kapit ng pasyente sa delusion, hindi pinipilit na baguhin agad ang paniniwala niyo. So, instead, goal muna is mabawasan ang stress na dulot nito. And then, next is main goal, reduce distress even if believed praises. So, delusional interpretation may remain or return, but the stress in nature is greatly reduced. So, ang success ng therapy, hindi lang base kung nawala ang delusions, kundi kung paano ito pinapansin ng pasyente. Minsan, kahit present pa rin ang symptom, hindi na ito nakaka-epekto sa daily life ng pasyente mismo. So, of course, the final lesson is the CBTP is about empowerment, no? So, ang pinaka-importante, no, empowerment ng pasyente, hindi mo tinatanggal lang ang symptoms. Tinuturuan mo silang paano mabuhay ng normal and may dignity kahit may schizophrenia. Now, let's move on to the background and associated factors, phases of the disorder, and relationship to aims of treatment and associated features and disability. So, this table, no, na ipapakita ko, it talks about the different phases ng schizophrenia. Kasi hindi lang ito isang big event, no. It is a process. So, sa bawat phase, mayroong specific goal at treatment na bagay sa kaya. So, first is yung pre-illness prodrome phase. So, dito nagsisimula yung very early signs, hindi pa full schizophrenia. Pero may mga changes na sa behavior, like pagiging withdrawn, paranoid, or iba na mag-isa. Goal natin dito is prevention lang. So, we use CBT or cognitive behavioral therapy to help the person identify and manage these early signs before maging psychosis. So, for example, kapag napansin natin na laging anxious or may konting delusions, CBT can help stop it from getting worse naman. So, next is itong acute episode phase. Ito naman yung stage na talagang active ng symptoms. May hallucinations, delusions, paranoid. The goal is to speed up recovery. So, we use CBT with coping training para turuan yung person how to deal with this experience. Like, for example, kapag may narinig siya na voices, matutulungan siya ng CBT to understand na it is a part of the illness and not real. So, coping training helps manage reactions like grounding techniques or stress management. So, pangatlo naman, partially remitted or residual symptoms. So, sa phase na to, may improvement na, pero may natitira pang symptoms like mild paranoia or confusion. So, ang goal dito is symptom reduction. So, we continue using CBT, but now, dadagdagan na siya ng self-esteem enhancement kasi usually mababa na ang confidence nila after the acute phase. So, for example, baka iniisip nila na baliw sila forever. So, we work on building self-worth and reminding them na pwede silang gumaling. Pangapat is the remission phase. Okay na sila, no more obvious symptoms, stable na, but relapse is still possible. So, the goal here is relapse prevention. Tuloy pa rin ang CBT. So, teaching them how to stay well. Also, family intervention is important para alam ng family how to support them and what signs to look out for. Like, for example, kung dati naging tahimik and isolated si client before mag-relapse, the family needs to know that and act early. So, lastly is the relapse prodrome phase. Ito yung phase na parang babalik na naman yung illness. May mga early warning signs like pagiging paranoid ulit or mood swings. So, ang pinakagol dito is to avoid the relapse before bumalik sa full psychosis. So, dito, early detection is the key. Kailangan alam ng client and ng family paano i-identify yung signs and what to do immediately. Like, balik CBT sessions or take meds on time. So, next, let's move on to the table where associated feature of schizophrenia. features that need to be assessed and considered as potential difficulties in the psychological treatment of schizophrenia. So, of course, let's proceed sa psychological features. No? These are the internal struggles ng may schizophrenia. So, first, itong disrupted or slow thought processes. So, parang ang hirap mag-connect ng ideas, mabagal mag-isip, minsan, hirap mag-decide kahit mga simple things lang. Then, second is yung difficulty discriminating signal from noise. So, parang kahit normal na tunog, feeling niya may hidden meaning. Akala niya, for example, akala niya yung tunog ng electric fan, may message para sa kanya. So, kapag yung mga taong may schizophrenia, dumadanas minsan ng ganyan. So, next is restricted attention. So, ito naman, madaling ma-distract, hindi nakafocus, or hindi makafocus, kahit kausap mo siya, lutang siya, ganun. And then, next is hypersensitivity to social interaction. So, napaka-conscious ng taong may schizophrenia or anxious sila sa tao. So, parang feeling nila lagi silang ginajudge. Next is difficulty in processing social signals. So, hindi niya gets kung galit ba yung kausap niyo or masaya. Kaya nahihirapan siya makihalubilo. Ganun. And then, next is flat and restricted affect. So, wala masyadong reaction sa mukha. So, kahit masaya or malungkot siya, parang walang expression doon sa tao. Next naman is elevated arousal, dysfunctional arousal regulation. So, mabilis na ma-overwhelm. Small things can trigger stress or panic naman. Next is hypersensitivity to stress or life events. So, kahit minor problems lang, sobrang bigat na para sa kanila yung mga ganun. So, super naging sensitive sila. So, high risk of depression and hopelessness. So, dahil sa condition nila, nagiging super down yung mood nila. And next, effects of trauma. Minsan, may post-trauma pa nagiging dahilan pa para mag-worse yung symptoms nila. So, next naman is stigmatism. So, dito, nararamdaman nila na o yung client na hinusgahan siya ng society. Like, for example, yung tinatawag siyang baliw na mga kapitbahay. So, ganun. Next naman is low self-esteem and self-worth. So, feeling niya wala siyang kwenta. Madalas nilang nafe-feel yung mga ganyan. Next naman is high risk of substance and alcohol abuse. So, yun na, minsan gumagamit sila ng drugs or alcohol to cope, which makes everything worse pa, no? And then, next is yung high risk of suicide and self-harm. So, of course, dahil sa hopelessness, yun na, iniisip nilang walang pag-asa. And then, lastly is the inference of normal adolescent and early adult development due to onset of illness. So, lalo na kung adolescents, no, nagsimula na yung symptoms. So, nahihirapan silang mag-grow emotionally or socially. So, next, let us proceed to the psychosocial features. No? So, first is we have the hypersensitivity to family and interpersonal environment, including that created by professionals. So, of course, kahit small criticism from family, sobrang sakit na para dun sa mga taong may schizophrenia. No? So, halimbawa, kapag sinabihan mo lang ng ang tamlay mo, feeling niya, na-attack na siya. Second is the risk of perpetrating or being the victim of violence. So, dahil minsan wala sila sa tamang pag-iisip, pwedeng makapanakit or masaktan ng iba sila accidentally. So, proceed tayo sa social features. So, we have the conditions of social deprivation. So, of course, walang access sa proper social support or community. Minsan, second is yung poor housing. So, minsan walang maayos na tirahan. And then, next is downward social drift. Dahil sa illness nila, bumababa ang social status or economic standing nila. And then, sometimes, unemployment and difficulty in competing in the job market. So, hirap silang makahanap ng work dahil sa stigma or symptoms, no? And then, meron ding restricted social network. So, konti lang yung mga kaibigan nila or wala talagang close na tao sa buhay nila. And then, next is, lastly, the psychiatric career interfering with utilization of other social resources. So, minsan yung pagiging diagnosed ng schizophrenia naging hadlang pa sa pagkuha ng ibang tulong. So, in summary, hindi lang symptoms ng schizophrenia ang dapat i-address. We also have to consider the whole picture, psychological, psychosocial, and social struggles nila. So, kaya dapat tailored ang treatment bawat piece and dapat sensitive tayo sa mga difficulties na ito para maging effective ang intervention. So, that would be all. And my co-member will continue the discussion about the schizophrenia and other psychotic disorders.